Hearing none, the chair calls William Martin. Good afternoon. Thanks for being here. If you'll state your name, who you represent, and your position on the bill.
Yes, my name is William Martin. I'm the Director of the Drug Policy Program at Rice University's Baker Institute, which I represent, and also myself in speaking in favor of this bill. I want to use my time to talk about the politics of supporting this bill. Since a bill essentially identical to HB 3256 passed the House by 92 to 37 in 2015, and the members of this committee are familiar with proven public health measures, I assume that a majority of you will vote for this bill unless you feel it might be held against you by some constituents or perhaps unpersuaded colleagues. But let me offer some support. If you're a Republican, recall that in the last several sessions when the Texas Senate has taken a vote, Republican-authored syringe bills have passed with solid majorities. In Congress, Democrats have generally favored providing federal funds for syringe exchanges, and Republicans have opposed it, but that has changed as a number of states, particularly in the coal and rust belt sections of southern Appalachia, have experienced a significant opioid epidemic, forcing accommodation to well-settled science. After several years of an average of 5 new diagnoses of HIV per year in the southeastern part of Indiana, 169 cases appeared in the first 6 months of 2015, and more than 20 new cases were being diagnosed every week. More than 80% of those individuals also had hepatitis C. With no legal way to obtain sterile syringes, they spread the viruses by sharing used needles. Under pressure from public health officials, then Governor Mike Pence reluctantly allowed counties to set up syringe exchanges, but put numerous obstacles in the way of rapid implementation. The New England Journal of Medicine scored Pence's foot dragging, and a spokesman for the Foundation for AIDS Research said, "We must give Governor Pence credit for finally doing the right thing in the end," but he called the state's HIV outbreak entirely preventable. Indiana taxpayers could have been saved millions of dollars for treating those affected by the HIV outbreak if effective prevention policies were already in place. Vice President Pence's example, although limited, may sway governors and legislators who have been reluctant to accept syringe exchange, but Kentucky's experience will have a greater impact. In 2015, faced with a significant HIV problem and a hepatitis C rate nearly 7 times higher than the national average, the Bluegrass States General Assembly passed an emergency measure that permitted health departments to establish syringe exchange programs, but had no funds to support them. Except for the first 4 years of the Obama administration, Congress had banned federal funding for syringe exchange since 1988. Fortunately, Kentucky had Republican friends in high places. Under pressure from constituent communities, Representative Hal Rogers, the powerful chairman of the U.S. House Appropriations Committee, and Senate Majority Leader Mitch McConnell successfully tucked removal of the ban into the 2016 omnibus spending bill. As you consider the politics of this bill, please note that some of the nation's most important and powerful Republican leaders have said, yes, we should have syringe exchanges, and if necessary, we can use taxpayer money to pay for them. Thank you.
Thank you for your testimony. Chair Coleman.
Yes, just briefly. Yeah, we passed that out of the County Affairs Committee.
I remember.
And Ruth Jones McClendon was the lead author on that bill, and it's good to see you pick it up. That's really good. We keep trying. We kept trying. I'm glad to see that we're still trying. Thank you very much, Representative Rose.
Thank you.